But something else that I've noticed in headlines is when it comes to drugs like Ozempic, Wegovy, things like that, the headlines are, oh, they're just shedding weight for a wedding, shedding weight for aesthetic reasons. But are these drugs actually life-saving too?
So the treatments have only been studied in Ozempic has only been studied in patients with type 2 diabetes, and Wegovy's only been studied in patients who have a BMI greater than 27 with a comorbidity or those who have a BMI of greater than 30. And so for Roe, those are the only patients who have access to treatment, and those are the only situations in which insurance is covering treatment. So for us, we really focus far more on who is on label for these different treatments, and then we work towards getting coverage for those patients. What I would say more broadly is related to certain people is that for whom this medication is clinically appropriate, it can be life-changing. And I think that there are instances in the press, and there are no doubt instances out in the world where people who aren't clinically appropriate for the medication are getting access to it. And I think that has the one, obviously that shouldn't happen. But two, I do think it clouds the discussion around how important it is to make sure that we can increase access for those who are, because truly the majority of the US population is clinically eligible for either Ozempic or Wegovy. The challenge has been insurance coverage. The challenge has been there's a national shortage of the drug, which happy to talk of Wegovy, and there has been shortages of Ozempic. Again, happy to touch on that and what Ro is doing through the shortage. But I think that overall, that's how we think about it.
Let's talk about some of the challenges that these drugs are facing, specifically Wegovy. As you said, there is a national shortage. Can you speak more to that?
Yeah, so Novo Nordisk, the manufacturer of both Ozempic and Wegovy, they've announced that there is a shortage of some of the initial doses of Wegovy, so 0.25 milligrams, zero point 0.5, and 1. And they have stopped the majority, if not all, of top-of-funnel promotional advertising. So this shortage is causing challenges for patients, for providers, to deliver the highest quality care for patients, as well as pharmacies themselves, right? As patients come in, pharmacies are having trouble making sure they have enough stock to deliver it for patients. So we did a few things once the shortage was announced. One of the first things that we did was we stopped all top-of-funnel advertising, all TV, all radio, and any ad with the mention of Wegovy in it. We simultaneously notified all patients of the shortage, both before they sign up, as they sign up, and along their journey. We've added additional GLP-1s to our formulary, so additional treatments in addition to where clinically appropriate, prioritizing Ozempic, where patients are eligible. We've also added Saxenda, which is a daily injection, also a GLP-1 that's FDA approved for weight loss. And we have consistently increased the number of pharmacies that we will call on behalf of patients, 5, 10, sometimes 15 pharmacies to find stock for patients, and then proactively messaging all patients what we're seeing on the ground. So while Novo has actually only announced shortages of 0.25, 0.5, and 1, we are seeing patients start to have challenges accessing other doses of the drug as well. And so it has presented challenges for patients, providers, and pharmacies alike. And so what we are trying to do is be exceedingly transparent with our patients, do everything we can to find them access to the medication. If they're unable to, we are issuing credits to them so that they're not paying for the service as we navigate the shortage together, and working hard to add additional treatment options. But it is definitely causing challenges across the board, and I think really does highlight the need for this treatment. We've never had a treatment that's ever been invented where the majority of the US population both wants and needs access to it.
Clearly, the demand is exceeding the supply here. So, do you see that changing anytime soon?
Novo has given guidance that the shortage will subside in September, but I'm not so sure that will be the case. I think we'll have to wait and see. I think that the best thing that can possibly happen is that additional manufacturers come online. So There's another drug called Mounjaro, which is currently FDA approved for type 2 diabetes, but is being expedited and under review for FDA approval for the treatment of weight loss. And as I mentioned, there's a tremendous number of new innovative treatments in the pipeline. And in addition to that, Saxenda, which is a daily GLP-1, again, that is set to become generic in the not too distant future. So I think that in the near term, it'll be very difficult for manufacturers across the board to keep up with the demand simply because it is so significant. But I think over the next 12, 18, 24 months, once demand becomes more predictable, once more manufacturers come online, I think that hopefully we will be able to we'll be able to solve this challenge as a healthcare system.